Hepatitis A, a liver disease caused by infection with the hepatitis A virus, referred to as HAV, is diagnosed by the use of appropriate serologic tests. The diagnosis of acute hepatitis A is confirmed during the acute or early convalescent phase of HAV infection by the presence of IgM antibodies to HAV, referred to as IgM anti-HAV. This serologic marker is shown by the pink hatched line and is usually present from 5 to 10 days before the onset of clinical symptoms, noted by the purple bar. The median onset of symptoms is 28 days after infection, noted by the vertical dotted line, but can range from 15 to 50 days. IgM anti-HAV usually declines to undetectable levels within 6 months after infection. IgG antibodies to HAV, referred to as IgG anti-HAV, shown in the black hatched line, begin to rise at or right before the onset of clinical illness and persist to provide lifelong immunity. IgG anti-HAV is also produced following immunization with hepatitis A vaccine. Some commercial tests only measure total anti-HAV, which includes both IgM and IgG anti-HAV. Serologic tests for IgG anti-HAV or total anti-HAV may be used to determine whether a patient has been infected with HAV in the past or remains susceptible to infection, but are not helpful in diagnosing acute illness. In persons with acute hepatitis A, HAV replicates in the liver, is excreted in the bile, and is found in highest concentrations in stool and thus peak infectivity during the 2-week period prior to onset of clinical illness. This period of viral shedding in stool is shown by the orange bar. Virus concentration in stool declines rapidly after jaundice appears in adults, although shedding may be prolonged in infected infants and children, even up to several months after the onset of clinical illness. Chronic shedding of HAV in stool does not occur. However, shedding can occur in persons who have relapsing illness. ALT, shown in blue, stands for alanine aminotransferase, a liver enzyme that is elevated when the liver is inflamed. Viremia, shown by the green bar, occurs soon after infection and persists through the peak period of liver enzyme elevation. However, methods to detect viremia are generally limited to research laboratories and are not commonly used for diagnosing illness. This segment is now complete.